all in, get the edge you need to succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Tammy Randall and Helen Dumski from the Case Western Reserve University's Masters in Public Health Nutrition and Dietetic Internship based in Cleveland, Ohio. All right, welcome to the podcast. To start us off, we're going to have some introductions from Tammy and Helen. Give us a little bit of background on your journey to RD and how you landed at Case Western.
Well, thank you, Dr. McKinley. I'm Tammy Randall. I am the director of the MS in Public Health Nutrition Dietetic Internship program at Case Western Reserve University in Cleveland, Ohio. I am also a graduate of the program and a graduate of our undergraduate DPD program at Case Western Reserve. So I'm kind of a lifer. Most of my career has been spent in diabetes education and management. After undergrad, I didn't know what I wanted to do with my life. And so I worked for a small nonprofit diabetes organization and realized I loved it. And since it was a community organization, decided that I was going to do my internship in a community-focused program / public health. And so I went to the CASE program, got my MS in public health nutrition, and I worked in a couple of different settings, both community, and I also worked at Cleveland Clinic here in Cleveland, Ohio as an inpatient diabetes educator. And then when I had the opportunity to join the faculty at CASE, I jumped on it because really being a diabetes educator is just kind of like a teacher, but your patients are your students. So I have been the internship director for 5 or 6 years. Now I can't remember, but somewhere around there. And I am thrilled to be joined today by Professor Helen Dumski, who is our supervised practice coordinator, and I will let her tell you a little bit about herself.
Well, thank you. And thanks, Dr. McKinley, for inviting me also to this podcast. I've been with the program just over 5 years. My road to this position has been, I've been a dietitian for over 40 years, primarily have spent my career in diabetes, and that's how Professor Randall and I met each other a couple of moons ago at the local Diabetes Association. And I too have spent most of my career in diabetes, much more on the management and administrative side, and really took an interest in nonprofit management, and have spent some time managing a couple of nonprofits. And then this opportunity came to work with Professor Randall, and it's kind of brought me full circle back to my roots in nutrition and dietetics and working with students. I've been a preceptor for a number of years, so this is a great opportunity for me to work with students and hopefully be a mentor to them.
All right, perfect. So I will let you roll right into your presentation and tell us all about your program.
Great, thank you. So Case Western Reserve University is in Cleveland, Ohio, in a really cool little area called University Circle that has museums and Severance Hall that houses our Cleveland Orchestra. And we are home of world-class programs in engineering, law, medicine, dentistry, nursing, management, and the liberal arts. We are small. We have about 10,000 students from all 50 states and 91 countries this year. The Department of Nutrition at Case is housed within the School of Medicine, and we were established in 1913. And according to U.S. News and World Report, we are one of the leading research universities in the nation and ranked first in Ohio for best grad school and 24th in the U.S. On their best grad school list for medical research. Our department is a little confusing in that we offer the graduate degree for 3 different internship programs. On the left of your screen, you'll see the Combined Dietetic Internship Master's Degree Program, or CDIMDP. If that isn't a mouthful, I don't know what is. The students who are completing their internships at University Hospitals Cleveland Medical Center or our Lewis Stokes Cleveland VA Medical Center also receive their MS in nutrition from our department. Our program that I'm talking about today is on the right-hand side of your screen, and that is the MS in Public Health Nutrition Dietetic Internship Program, and it is accredited through the university, and we have a concentration for public health and community nutrition. We have accreditation for 14 interns, so we take 7-ish every spring. We went a little light last match cycle because we were in the start of a pandemic. So hopefully we will be back to our normal class size this coming match. A little bit about our program. I'm kind of a dork when it comes to cool nutrition and history stuff. Our degree was the first MS in Public Health Nutrition offered in the United States. It was first offered in 1941. We were accredited as an internship in 1986, but even though we were only accredited as an internship in 1986, the Public Health Nutrition Program has always offered basically an internship. In the public health world, we call it field work. And so we have had that component since the origination of the program. We just weren't accredited as an internship until the mid-1980s. The program was the brainchild of Helen, who you see down there in the corner, and she was our department chair for 40 years, I believe, and she was also a president of the Academy of Nutrition and Dietetics in 1947 and 1948. The program is 16 months, starting in August and completing at the end of the following fall semester. And we just graduated our 79th class of interns, and you will have the opportunity to hear from one of those wonderful interns in a couple of slides. Megan will give us a little bit of perspective from the student side of things. So as I have mentioned, we have a public health community nutrition emphasis. So therefore, the largest block of hours in our program is in a public health facility. And our students, when we're not in the middle of a pandemic, spend 12 weeks at an agency during the summer out of town, outside of Cleveland, simply because we don't have enough agencies within Cleveland to have all students stay in Cleveland. And the students function as public health registered dietitian nutritionists, and they complete a community needs assessment before they go, so they know something about the community. And they also do an agency program assessment, and we have instituted a new course that will have kind of a follow-up after they return to Cleveland after that experience. But we find that this is the opportunity for students to really get a feel for what it would be like to be a community or public health dietitian. It's very similar to staff relief if you were looking at a clinical-based internship. So where do we send our students? Literally from coast to coast. We have sites, the Arizona Department of Health has taken students, the state of Massachusetts WIC program. Megan was at the New York City Department of Health and Mental Hygiene, virtually. The Ohio Department of Health, the Ohio Department of Aging, I didn't put up there. We've used Utah Department of Health. We've also used federal programs like the Centers for Disease Control and Prevention and the U.S. Department of Agriculture Food and Nutrition Service regional offices in Chicago and in Boston. So what does the program look like? In fall of the first year, we take advantage of the fact that you are coming out of an undergraduate or perhaps a DPD standalone program, and you are in the routine of being in the classroom. And so the fall of the first year is when we give you our heavy load of courses. Spring of the first year is when you actually start your internship. There's a required course on Monday, you take an elective on the other part of Monday or on a weeknight, and then your internship rotations are Tuesday through Friday. Summer is Monday through Friday, that block field experience in a public health facility away from Cleveland. And then that last fall, you have a class on Monday and then an elective sometime around your internship rotations Tuesday through Friday. So what are those classes? In the fall of your first year, we have the rather nondescriptly labeled Seminar in Dietetics 1, which is an advanced medical nutrition therapy class. And in that class, not only will you see the other public health nutrition dietetic interns, but you will be in there with the interns from the other two programs who receive their degree from our department. You will also take investigative methods in nutrition, which is kind of a research boot camp class. You take diabetes prevention and management, and the reason is diabetes is a chronic condition that regardless of where you end up working, you will see patients with diabetes, whether it's in the hospital, in a clinic, or in a public health facility. And then you have time for an elective. We do a slightly lighter course load in the spring because you are starting your rotations. We have Intro to Public Health Nutrition on Mondays, and then you take a course that is your internship, and that's Public Health Nutrition Field Experience, so you get academic credit for that, and you also have the opportunity for an elective. In the summer, you register for Nutrition 534, which is that block public health experience outside of Cleveland. And then in the fall, as you are getting ready to graduate, you will take Public Health Nutrition Evaluation Methods, which is Nutrition 530. Also will register for Specialized Public Health Nutrition Field Experience. That's your internship, and you have time for an elective. So we talked a little bit about the block field experience, which is the public health experience, that longest block of hours. But where do you do all of your other rotations? Well, those are all within the Cleveland area because you will be doing them while you are going to classes. Your acute care rotation will be at one of our community hospitals. All of our large academic medical centers in Cleveland have their own internships. So we use the community or the satellite hospitals, or sometimes we use long-term care facilities for students who are interested in gerontology. We have a counseling skills rotation that is not one that a lot of internships offer, as far as I know. And our belief is that there is a bit of angst when you first start working with patients about whether or not you know what to say at the right time. How do you get to know someone? How do you build rapport with that patient? And if you're doing that in your acute care rotation, you're probably very concerned about whether or not you have figured out the right diagnosis for the patient. You have a lot of other things that you're thinking about. So we offer a counseling skills rotation in a low risk site so that you can learn how to build rapport with patients without worrying about the heavier duty medical nutrition therapy concepts that you might need and will need in your acute care rotations. So we use the WIC sites from the Women, Infants, and Children Supplemental Nutrition Program. We use outpatient clinics, wellness centers. Those are some of the counseling skills rotations. Our food service management rotation, we primarily use schools. We also use long-term care facilities. We have a community rotation. We've used the Hunger Network of Greater Cleveland. We've used the Greater Cleveland Food Bank. And then we have time for an elective rotation, and we work with the students to figure out what their interests are so that we can place you in a rotation that meets your interests. And so we've used our Case Western Reserve University Prevention Research Center, which is a CDC-funded center looking at creating healthier communities in the Cleveland area, some outpatient clinics, and we've had some students who are interested in renal nutrition, so we've used the local dialysis centers. One of the kind of cool opportunities that we have as a department is we have a number of faculty members who have an expertise in maternal and child nutrition. And so we have put together a graduate certificate in maternal and child nutrition that can be an option for the students to complete while they are completing their internship and master's degree. And there are 2 required courses for that. That's nutrition for pregnancy and lactation, as well as pediatric nutrition. And then a couple of electives that you can choose from to make up the 15 credit hours that are required for the certificate. A couple of your required courses for the internship also count for this certificate. It's not required that students complete this. It's just an option if you have an interest in working with pregnant moms and kids. And because we have the expertise, we decided to put it together as something that you can hang on your wall when you finish your internship and have this certificate. If someone is interested in this certificate option, Professor Dumski, who coordinates the rotations, will try to gear your experiences so that they are focused on that population, working with pregnant moms and kids. So if you are working in your counseling rotation, instead of perhaps being in an outpatient clinic where you would see a variety of different conditions, you would do the WIC option so that you would work with pregnant moms and kids. And we do that as much as we can for all of the rotation. I will stop talking for a few minutes and I will introduce Megan Dillon, who is a very new grad of our program. Literally, 5 days ago, we had our department graduation ceremony. Megan is the second from the left in the picture that you see on your screen. This was an outing that we went to a hockey game in Cleveland. We don't have an NHL team. We have I don't know what it's called. It's the minor league kind of for the NHL. So that was an outing with some of our graduate students. So Megan, I'm going to be quiet and share whatever you think students need to know about this program from your perspective.
Thank you, Professor Randall. First, hi everyone. I'm very honored to have the opportunity to share my experience and some of the highlights of the program with you that haven't already been covered. To start, I want to talk about Cleveland, which I think was one of the best aspects of the program for me. I absolutely fell in love with the city while I was there, and I was a little bit more than skeptical when I first matched to the program. I'm from New York, so Cleveland's rep around here isn't great, and a good social life is really important to me. So I was hoping that what I had been told during my interviews was true, that I'd have a lot of fun, and it was absolutely true. There's a lot to do in the summer, whether it's kayaking on Lake Erie. I went biking with my friends through the national park, and there's just as much to do in the winter, whether it's going to the Cleveland Cavaliers basketball games or dining at the restaurant scenes. And side note, the food around there is incredible. Or trying one of the over 30 breweries that the city has to offer. I was never bored, and it made it very easy to meet people and make friends over there. I also want to note that Cleveland is so affordable, which was important for me as an intern, because I wasn't working, and I know most interns aren't working. So when you are choosing programs, if that's something that's important to you, it's something to keep in mind. The Cavaliers games, when I would go, were $7, whereas if I were to go back home, it was $180. It was a real special occasion. So I definitely went to all the sporting events while I was in Cleveland, and the nutrition department does a really good job about getting us out to see the city as well. Like Professor Randall mentioned, we went to the hockey game. We also went apple picking and rock climbing. And there were some plans to do maybe a candle making or paint and sip event. I'm not sure if it was ever decided, because then COVID started, so we never got to do it. But they're really good at taking our feedback and trying to figure out what would be interesting for us. Another unique part of the program is that it's 16 months long, so there will be second-year interns when the incoming intern class is starting. And we're paired up with a buddy that will help you answer any questions that you have about life in Cleveland, or just the graduate courses, or life as an intern. And I found that really important to have. I became really good friends with my buddy. I call her one of my highest quality friends. And I really appreciated having a resource there. And she kind of showed me around the city and got me out of my shell, because I didn't really know anybody when I moved to the area. So I think that is a really unique way to transition to a new area, which I really appreciated. And then lastly, I wanted to highlight how incredible the faculty is. From day one, and honestly, even before that, from the day of my interview, I've always felt supported by the program director and coordinator and other faculty. They went out of their way to help me get experience, whether it was within my rotations or whether it was inviting me to participate in program development for the Academy of Nutrition and Dietetics, or even just participate in this podcast. And more than that, the faculty truly value and consider the feedback that the interns have to offer. I actually noticed as we were going through the presentation that the sequence of and courses required have been adjusted than what I took. So if you want to continually help improve a program and have an impact and help future interns have a good experience, you'll definitely have the opportunity to do so in this program. I hope that this doesn't sound too sunshiny for everyone, but I did want to highlight some of the really unique portions of the program. But there are some things to consider. First, whether you truly want a career in public health. Second, if you're comfortable driving in the snow, because it will snow while you're here. And third, you should consider the financial aspect associated with getting a master's degree. But I'm happy to talk with anybody about specific rotations or how the school handled our interrupted rotations with COVID, or any other questions that you have via email in the future. Thank you.
When you said it, I remembered about your skepticism about our lovely city, but I'm glad that we made you a convert to a Cleveland lover. here are just some program outcomes. So if you are a DPD student looking at different programs, I think you should take a look at the pass rate on the RDN exam. And we have a 98% first-time pass rate over the last 5 years. And our students actually get jobs. Within 6 months, we have a 99% employment rate. And many of our members are active members of professional organizations, our local Greater Cleveland Academy of Nutrition and Dietetics, our Ohio Academy, as well as the National Association. We have graduates working in all levels of volunteerism with our professional association, and we try to encourage that because we think you get a lot out of it personally. So what are our students doing after graduation? All kinds of interesting things. You know, we're a public health program, but we have graduates working all over the place because you do get the food service experience, you get the clinical experience, you get the community, the public health experience. So we have students working for government agencies like HRSA as a public health analyst. We have someone working as a researcher for Abbott Labs. We have people working in the WIC program at all levels. We have people working in public health departments. We have some health coaches for Gem Care Wellness and also Be Well Solutions, which is a health coaching company here in the Cleveland area. And then we also had someone who was the Assistant Director of Child Nutrition Programs for the State of Ohio Department of Education. So we have students across the board. And then there are plenty who are also working in clinical also, but I thought these were a little bit more unusual than the clinical placements. So as Megan referenced, the financial implications of a graduate degree. Here is the total program cost for our program, and I know it is a lot of money. This is the tuition rates based on the 2020-2021 tuition, which is why there's an asterisk by our second fall, because unless the earth stops spinning, probably tuition will go up again next summer for next fall. But the estimated program cost is there for you. We do have a tuition stipend that is an endowment specifically for students in this program. And we offer that tuition stipend in 3 installments of $5,000 each. You receive one in the spring, one installment in the summer, and then one in your second fall. And the reason for that is financial aid implications. If you are a full-time student, you get more robust financial aid packages than when you are a part-time student. So we give you the stipend in your spring, summer, and second fall. And, you know, we are a regular academic institution, and so you have the opportunity for financial aid as well as, you know, any scholarships that are out there. The Academy of Nutrition and Dietetics has a lot that you should look into, no matter where you go. So if you are interested in apply to Case Western Reserve University. And the reason I put that in a different color is just because of that weirdness with the other 2 programs that received their degree from our department. For those programs, you apply to the hospital. For our program, you apply to the university. And students who are matched will not need to apply to the graduate, sorry, I'm saying this backwards. So those who apply to our internship do not need to apply to our School of Graduate Studies until you know you are matched. Otherwise, you're just spending $50 and you may not end up coming here. And so save your $50 until after you match, and then it's a formality because we don't rank anyone who would not be accepted into our graduate school. And so I have a final slide here with my email address. I am happy to answer any questions that you have. There is my phone number. There is our program's website. And we have a virtual open house for actually all 3 programs affiliated with our department that's on our website. You can get to it from that link there. And then we do a live question and answer session twice, once in November that has already happened, and once that is on January 21st. And I believe it is at noon Central. So thank you, Dr. McKinley, for inviting us. And if we have any questions, we will tackle those.
All right. Thank you for that thorough overview. And I can agree with Megan. I had not really known what Cleveland had to offer before I went there for an in-depth meeting a couple of years ago. And I kind of became obsessed to where I keep telling my husband, like, we need to go back. Like, you need to see this for yourself. It's not what we thought it was. All right, well, we will jump right into the 5 questions that I ask all the directors that come on the podcast. And these questions were put together with the help of my students to really make sure that I was asking the questions that were giving them the information that they felt they really needed to be strong applicants to these programs. But the first question is, what is something that you particularly love to see when you're reading an applicant's personal statement?
I'll give you my answer and then I'll let Helen give hers. So I like to see something that tells me who you really are beyond a reiteration of your resume that's also attached to the DICAS application. If it's your resume in paragraph form, that doesn't tell me anything else. I want to know who you are, what drives you to study nutrition, and specifically why you chose our program. We always laugh that we get students who say that they want to work in nutrition support and they apply to our public health program. And I think, well, I'm glad that you're honest, but maybe that's not the best fit. So I want to really get to know you. Helen, what do you think?
I will reiterate about not in the personal statement is don't make it a repeat of your resume. We've taken a look at that and we go line by line on that. I also like to see some sort, again, of a picture of you of what makes you thrive. What are your interests? What do you think your communication skills are? Or do you have some sense of resilience or how you've adapted to a situation? So to give examples of that as opposed to just reiterating what's on your resume.
Speaking of resumes, my second question is a true or false question about resumes. True or false, an applicant's resume should be 1 page and 1 page only. Either way, why?
I think it needs to be an appropriate length for what you have to tell us about you. I don't care if it's more than 1 page, but if you have only done one volunteer opportunity in your whole life and you have a 3-page resume, perhaps you need to think about how much you're explaining about that. And conversely, if you've done all kinds of cool things, tell us about them. Don't limit yourself to 1 page. I don't care 1 page versus 2, but it should match the experience that you have, giving us enough detail so that we know what you have done and what skill set you are bringing to our program. Megan, do you want to add anything? We had this conversation as the interns were getting ready to start applying for jobs.
Be 2 pages, and I'm glad that you agree because I did 2 pages on all of my applications. So I hadn't heard that it was a bad thing. So again, I think if you think that you have experience that requires more than 1 page, do it, but don't just try and fill space because that won't look good either.
I think again, I think 1 or 2 pages is reasonable. I think we've had one where it was like, I don't know, 5 or 6 pages. And it really, you stop reading after the middle of the 2nd page. So I think, and it also tells us something about you, that you have the need to, tell us every single thing about your life, is that try to be as concise as possible and let us know what strengths and skills that you're bringing to the program.
All right. And if you're curious where that question came from, there are professional coaches out there that provide free advice to DPD students that claim on their websites that resumes that are more than 1 page won't be read. The 2nd page won't be read. And we all know that that's false. But I like to ask all of the directors that same question, just kind of get everyone's feedback on that. What is one thing that an applicant may do, and this could be in the application itself, maybe at an open house or in some sort of interaction that you have with them prior to their application? What is something that they may do that might raise some red flags or might be a total deal breaker where you might say, this person's maybe not the best fit for our program?
I will tell you that as much as I try to not judge, when someone emails me and says, I found your program and I'm really interested in it, please tell me more about it. Mm-hmm. I have a website and we spent a long time making it look nice and have lots of info on it. And it's really not that hard to find it. And so I find that if you didn't take the effort to at least hit the highlights on the website, I'm not that interested in having you be one of my interns because it seems like you could have put a little more effort in up front.
I think one of the things, again, is be interested in public health or community health. I think that sometimes applicants are just trying to fill out their applications and get into the deadline of DICAS and just want to get an internship. And I think that you really need to be thoughtful on what you're going for. Again, as Professor Randall mentioned, is that if your goal is to be clinical nutrition support or an administrator, this is probably not the program for you. You'll develop skills that could eventually lead to that. But our emphasis is on public health and community. And sometimes we have candidates that even when we're talking to them, even with some pulling and coaching to get them to talk about community or public health, they'll just stay with, I really want to work in renal. I really want to be a sports dietitian. And you're probably not going to be a good fit for us.
What is one area of the program that you're working on trying to make even better for the interns?
I would probably say it's what Megan referenced earlier. It's the curriculum, the order of it, the actual courses. When I took over the program, however long ago, 5 or 6 years ago, the curriculum had been fairly stagnant for quite some time. And we made a few changes. I didn't want to radically change anything because it got me through, so it must have been okay. But things need to change over a period of time to stay current with competencies for Ascend and what the profession is, moving toward or away from. And so we did a comprehensive assessment this summer of, are we requiring the correct classes? Are we requiring the correct order? And what's in the content of those courses? Is it what the interns really need? And is it what they're going to use in their internship and then therefore out in practice once they finish? So I think it's curriculum. And so I'm really excited. The one course that's going to be new starting a year from starting in August, a year from this fall, will kind of close the loop on the public health experience. So Megan and her colleagues had an opportunity to do the intro to public health nutrition, where they learn about programs and services in public health, and they did a community needs assessment. Then they did their block field experience, but we're going to close the loop, and we're going to have the students, when they come back to Cleveland, one of the required courses will be assessing the programs that they saw offered through their department. And are there any gaps in services? Is there something that they wish their program had offered? And then they will have the opportunity to develop a hypothetical program and figure out how to evaluate that program. And so that will kind of finish the series of your year in public health.
I don't say one of the things that we implemented that I think has been a plus and has gotten better as the couple of years have gone on is that our interns were never involved with the interns who were within our department from the VA or university hospitals. And now they take classes together. That very first semester, they're in class together. And we've noticed as faculty of just how important that has been as far as learning for them, that they see a cross-section from 2 clinical programs and also from the VA, a whole different perspective of an internship at the VA. So I think it's been a good crossover for all of our students. And also just in my little part of the world of making sure that we're up to date with preceptors and that we're meeting the needs of the students. When we're matching students with an internship, is that we really take into consideration what the students' needs are, what the preceptors' needs are, and really make that internship supervised practice a win-win for both the intern and the preceptor. We do spend a lot of time on our preceptor relationships to keep those going. Right. If we didn't have preceptors, we wouldn't have a program.
Very true. Very, very true. We love our preceptors everywhere. All right. So my last question of these 5 questions is a 2-parter. And the first part is, what would be the 3 best adjectives, descriptors, or phrases to best describe your program overall.
Historical, and that's kind of a cop-out, but I just think it's really cool that we were the first MS in public health nutrition in the country, and only one program can say that. So I think that's pretty cool. Dedicated. We have so many of our program faculty and preceptors who are involved with volunteerism in the Academy of Nutrition and Dietetics and the state affiliates and DPGs and such. And then student focused. I mean, I try, and I guess from Megan's perspective, it usually works, to make sure that the students' input is first and foremost what we take into consideration when we make a decision about the program.
Well, the thing that comes to my mind is comprehensive, is that the students get a supervised practice, even though our emphasis is on public health and community, that they have rotations in all aspects of the world of nutrition and dietetics, because they all take the same exam. So we want them to all have that same experience. They don't get as long of time in clinical, but they get 9 weeks. And I think that that's one of the strengths of our program is the amount of time that goes into each rotation. I'd also say that that we're approachable to and maybe Megan would disagree with that, but I think that our program and the staff and the other faculty are all approachable. We do listen to the good, the bad, and the ugly. We make changes as we see that it will improve the program. Can't say that we can change everything that the students bring to our attention. And the other thing is, I think that our program is a tough love program. It's a tough curriculum, but I think that our approach is that we want you to succeed. This is not to see that you're struggling. And if you are struggling, then we try to approach you that with, you are an adult. Let's talk about this and let's see how we can move through this.
I have some similar adjectives to what you two said. My first is well-rounded. Even though it is a public health program, you do get exposure to clinical and counseling. And now as I've started studying for my RD exam, I'm noticing that I really did learn so much. And if I didn't have it in my rotations, I had it in my classes. We had to take a research class, and that's coming in handy right now as I'm studying. The next is unique. I think that the amount of programs where you can go live in a different part of the country for a couple weeks are few and far between. So I think if you're not sure about where you want to live, or you want to go somewhere that might be a little bit too expensive for a year and a half when you're not working full time, that's a really great way to branch out and see a different part of the country. And then my last one is supportive, which I've already mentioned. I always felt like the faculty not only cared about my success in the internship, but just about what was going on in my personal life and cared about me as a whole person, not just as a student.
All right. Well, the second half of the question is very similar to the first. It would be 3 adjectives, descriptors, or phrases to describe your ideal applicant.
So mine would be open-minded, academically curious, and flexible.
Mine would be resilient, willing to take risks, calculated risks, and a genuine thirst for knowledge.
Those are good. I like those. All right. Well, I'm going to jump into a question for Megan, since you just finished the program. What would you say was your favorite course in the program that challenged you in a good way?
My favorite course that challenged me was the research course. I don't know if you remember this, Professor Randall. I'm really embarrassed about it now, but I came to you second week of classes and I was like, what's the minimum GPA we need to stay in this program? And what happens if I don't make it? And you were so kind and understanding, and research went fine. I don't know what I was worried about, but I really didn't have a strong research background and I was really nervous about taking that course. But I learned so much. We actually had a one-day field trip event where we went to a dialysis center and we interviewed patients about their dialysis experience, and then actually conducted the research, ran the statistical analysis, wrote a research manuscript. And it was so different than anything I had done in undergrad, but I learned so much and still feel so proud of my research manuscript. And I'm really appreciative that we had to take that course.
All right. Thinking about your rotations, Megan, what was your favorite facility that you were placed in, and what was so special about it?
I think my favorite facility was my food service rotation. I was with a contract food service company, so we had a couple different schools, I think 60 schools that my preceptor was overseeing. And it was my favorite because it's most in line with what I want to do. So it was really fascinating. It was my last rotation, so I felt like I hadn't really clicked with anything so far. So I felt like everything had come full circle at that point to have my food service rotation there.
Seeing as there is a master's degree involved, what's the minimum GPA that you're really requiring for applicants?
We ask for a 3.0. Now, there is some leeway. If someone is coming from a program that we know is very rigorous and they're really close, then we certainly give that applicant as much attention as we can. We usually, actually Megan brought this up, I sent her my slides and she said, what about the GRE? So we usually require the GRE, and that is because I don't have a set cutoff score. It just gives me another piece of information, right? If someone comes from a really good program and they're really close to our 3.0 GPA and they have a great GRE score, that's the ammunition that I need to say this student will be successful here. We are not currently requiring it because of all of the issues with students being able to take it due to COVID. So, but if someone feels like they would like to submit the GRE scores, I'm always happy to look at them, but be smart about them. If they're good, submit them. And if they're not, don't. So there's words of wisdom. So.
All right. So about how many applicants do y'all average each year?
About 30.
Well, I know you probably had this spring a lot of COVID changes. Have any of the changes that you had to implement for spring and then maybe for fall, are you planning on keeping any of those?
So our department is looking at offering, the hybrid model of some of our classes, whereas we were very much a residential university before March 16th, 2020. And so our department is looking at offering more of the coursework in a hybrid model, not 100% online after this ends, but perhaps hybrid. So that's one thing. The other thing, and this is a silly thing, but it is something I should have done a long time ago, but we were in the middle of interviewing intern candidates when COVID started. And so I thought, well, I don't know what I'm going to do with the interns this week, so how about have them help interview? And that was such a cool experience, and I'm going to continue doing that. I know programs have done that, for a long time. We just hadn't, because our interns are off-site in rotations when we're doing the interviews, but they were available this year, so we included them, and I will continue to do that. And this is also a silly thing, but I felt that it was really impactful. So we normally have an in-person department graduation ceremony for our interns. Couldn't do that this year. And so we had each intern put together a slide that would explain who they are to everybody watching the ceremony. And we did a Zoom ceremony, and it was as nice, I think, as it could be. But the slides, the opportunity for the students to put together a slide that they chose what was on it, was so incredibly cool that we're going to do that when we return to an in-person opportunity, because it gives much more personality to the graduation ceremony.
All right. Well, my last question is related to that very impressive exam pass rate. So how are you preparing your interns for that? What methods are you using?
Well, I'm going to admit that probably it's the students and not as much what we do. We have a really impressive student body, and the students that come to us are really bright and they work really hard. We give them access to some review materials, and we give them the voucher from CDR to take a practice exam, so you actually see what it will look like, the timer, the whole deal. And I think once we started doing that, and that's a silly thing, I mean, they're not expensive and it's easy to do, but once we started giving the students that voucher so that when they think they're ready, they can take a practice exam and see whether or not they're actually ready, I think that made a huge difference with the students feeling prepared and knowing when they should actually schedule it and take the exam. So, but I'm going to give the credit to our students. They're pretty amazing.
In pre-COVID, the students had the opportunity that to get together once a week if they so chose. And a lot of students did that. We didn't do it because of COVID right now, but I think that the students learned from each other too. And we had good feedback about that to have a study partner for the exam.
Yeah, that's true. I used to force them to get together once a week or once every other week to study, which was not quite possible this year. But I don't know if that helped or not.
And I know that one or two of the students took advantage of studying with one of the interns from one of the other programs so that they also could get a different perspective. People learn so many different ways and how to study and students are resourceful as to how to adapt to their best study, their study style.
I will share, Professor Randall, you had shared that you would have students studying together. So myself and two fellow interns have been studying every day together on Zoom, not on weekends, but every day together on Zoom since last Monday. So that's very helpful. And I think that part of it might be that you're not really putting an incredible amount of pressure on us. And I'll explain, I mean that in a good way. You're not saying our pass rate is so high, you need to pass. You are both so understanding and saying things happen. It's not a reflection on your intelligence if nothing happens, and not having that like increased anxiety and pressure from your professors, I think will probably help me go into the exam a little bit more relaxed, because I think myself and my fellow classmates will probably put enough pressure on ourselves and don't need it from anyone else.
That's wonderful you guys are doing that.
Good, I'm glad.
Another beauty of Zoom.
All right. Well, to close us out this evening, I would love it if each of you could give our viewers one last take-home message for potential applicants.
I think of what's most important to you, and then find a program that is similar to what your goals are.
Well, along those same lines is don't expect you to know what you want to be, at the end of the internship, but have some idea of the direction that you want to go, and that you are willing to explore opportunities, and know that the internship is a time to determine what you like and what you don't like. And that's okay.
I think my words of wisdom are, use this as an opportunity to do something out of your comfort zone. If you've always wanted to live in San Francisco, do it for this, year or 2 years or what have you. Look at programs, look at all the programs and the pros and cons. Don't limit yourself, because you just never know what you're going to end up loving. It could be the city, it could be the program, it could be a rotation. Just don't limit yourself, because once you start doing things that you never thought about, you might find out what you really do love.
And thank you so much for being with me this evening. And for those at home who are interested in getting more information on the program at Case Western Reserve University and to get into touch with Tammy or Helen, I've included the program link to their website in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome and amazing dietetic internship. And we'll see you next time.